Learning about glaucoma has definitely helped me feel empowered because it's such a complicated disease. There are subtypes and different symptoms. I have a version that appears to be hereditary, and even my sibling and my mother and grandmother have different symptoms, a different rate of progression, have responded to different medications. So the fact that I now understand that's normal and understand that when a treatment option doesn't work, that's not the end of the world, you can try the next thing, to me has really made me feel empowered and encouraged me to keep learning about the most recent advances, because the science is always changing. It's actually exciting. Treatments have changed an unbelievable amount in the almost 20 years since I was diagnosed. Surgical procedures in particular, I've benefited from one of the very new microinvasive surgeries, so that didn't exist when I was diagnosed. I'm on one of the newest eye drops, which again, thanks to all of the research that's been done, is more effective for me when I was treatment resistant to some of the most common eye drops that were out there. So it's helpful. A cure for glaucoma for me and my family would be incredibly exciting. There are 4 of us right now that are diagnosed, and I'm sure prior family members that lost some vision, if not all of their vision because of glaucoma, that I may only know a little bit about their stories. Patient connection is something I really underestimated at the beginning. This was the first chronic serious disease that I was diagnosed with. I was in my late 30s. Many, if not most, glaucoma patients are significantly older, so I would go to the doctor's office and I would feel like I was the only younger person in the room. So I felt very isolated. I felt like there weren't other patients that I could really relate to, and it was through some of my first interactions in the in-person GRF events that I felt like, okay, there are actually other patients whose stories are more similar to myself. The Glaucoma Patient Summit is a must-attend event because it's the only place, or certainly the best place, that I've experienced in 20 years as a patient where you meet other patients as well as physicians, as well as researchers, not to mention sponsors that are doing a lot of the good work to support patients.